Hello and welcome to this installment of the Emperor's Insurance Dictionary. Today we will be going over the term minimum essential coverage. In order to satisfy the individual mandate of the Affordable Care Act, all compliant health insurance plans need benefits deemed minimum essential coverage. In order to be considered compliant, these plans must meet the limits of cost-sharing, deductibles, copayment, out-of-pocket maximums, and other such charges. Minimum essential coverage is comprised of 10 essential health benefits as deemed by the government. All marketplace plans must offer some form of ambulatory patient services, emergency services, hospitalization, pregnancy, maternity, and newborn care, mental health and substance use disorder services, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness services and chronic disease management, and pediatric services, including oral and vision care. Let us look at each of these terms individually, starting with ambulatory patient services. Ambulatory patient services are also known as outpatient care, and they refer to any procedure that does not require an overnight admission to a hospital or facility. Some places where one might receive such services are dialysis clinics, ambulatory surgical centers, hospital outpatient departments, and the actual offices of physicians and other health professionals. Next, we look at emergency services. Emergency services are any sort of service provided by emergency care centers. All plans that meet the ACA requirements will provide benefits for both in and out of network. It is important to note the benefits, usually a co-insurance percentage for out of network, will usually be reduced compared to in-network. Next up are the hospitalization benefits, which refer to any procedure for which you are checked into a hospital or other facility and require multiple nights of stay. Bear in mind, these benefits usually have limitations, granting them only for certain periods of time, for example, no more than a week per calendar year. Next are the pregnancy, maternity, and newborn care benefits. All ACA-compliant plans will have some form of coverage for maternity benefits. These include services for both pre- and post-birth. Examples include outpatient services, such as prenatal and postnatal doctor visits, gestational diabetes screenings, and various lab studies. Inpatient services, including hospitalization and physician fees, newborn baby care, and occasionally counseling. Next up are the mental health and substance use benefits, which are best described as behavioral health treatment, including counseling, psychotherapy, mental health inpatient services, and approved treatments for substance abuse. All ACA-compliant plans must provide some sort of benefit for prescription drugs, usually a discounted price on prescriptions. All possible medications are categorized by tiers under the Affordable Care Act. Within each tier is at least one drug that your insurer has to help you pay for. However, these benefits are limited to those listed drugs. Similar prescriptions may not be covered. You must choose from the pre-approved list of your provider. The rehabilitative and habilitative benefits are used to pay for such services. Rehabilitative services help a person keep, get back, or improve skills and functioning for daily living that have been lost or impaired because a person was sick, hurt, or disabled. Habilitative services help a person keep, learn, and improve skills and functioning for daily living in general. These usually include, but are not limited to, coverage for physical therapy, occupational therapy, and speech therapy. All ACA plans will provide some form of coverage for laboratory services, which include diagnostic lab tests, preventative screening tests such as diabetes and cholesterol screenings, and basically any sort of work that would be considered blood work. Now we come to the most commonly used benefits of preventative and wellness, which include an annual checkup and also tends to include certain cancer screenings, high blood pressure screenings, HIV screening for ages between 15 and 65, and other screenings depending on risk. All ACA plans will provide these benefits. Lastly, we come to pediatric services. Pediatric service coverages usually include coverage for vaccinations, well-child visits, and oral and vision care for children. It is important to note that oral and vision care for adults is not considered minimum essential coverage, and it is therefore not included on most ACA plans without a rider. Lastly, it is important we understand the term covered. Just because a service is covered does not mean that it is free. It means that some amount of cost sharing is to be paid by the insurance company. For all ACA-approved plans, that amount of cost sharing can be determined by looking at their metal tier, which we will look at in a future video. All ACA plans have a total out-of-pocket maximum of less than or equal to $8,200 for an individual or $16,400 for a family at the time of this recording. Thank you all for joining me for this installment of the Emperor's Insurance Dictionary, in which we examined minimum essential coverage. Like if you learned something, and share this video with anyone you think will benefit from the knowledge. I will continue to add to this dictionary weekly. Comment below on anything you would like added to the dictionary or explained and made clear in future. Thank you all again for your support, and I look forward to seeing you next time to help you secure and conquer.